Okay, we're going to go ahead and get started here as more people are joining us. Hello, everyone. Thank you again for joining us on today's COVID-19 update. My name is Stephanie, and I'm the Communication Specialist at the Yakima Health District. Hola a todos. Si nos están acompañando esta noche, tendremos nuestra actualización de COVID-19 en español el próximo martes, sería el 15 de junio a las 6 p.m. Por favor, júntense a nosotros para mirar ese video en español. So, we are continuing our vaccination efforts here in Yakima County, and the site at the State Fair Park will continue to remain open. I'll provide a few more updates on the site, the new hours that are open 5 days a week, and then all the mobile vaccine locations that are available throughout the week. And then this evening, we also do have Dr. Larry Yeka, our interim health officer at the Yakima Health District, who'll be able to talk to us more about the vaccines, herd immunity, and how safe it is to travel now for fully vaccinated people. So if you have any questions about the COVID-19 vaccine or topics related to COVID-19, please make sure to put them in the comments section. I'll be monitoring it on Facebook. For those of you that are watching us, we do encourage you to ask your questions. It's a great opportunity to get those answered. And if you do have any other questions outside of these topics, please go ahead and still leave them in the comments, and we will try to answer those or address them at a later time. So to begin with, I would like to share my screen so I can show you how we are doing in terms of vaccination as a state as well as a county. So give me one moment while I share my screen here. Okay, perfect. So in Yakima County, we are continuing to see individuals get vaccinated and take advantage of all the vaccine opportunities that are happening throughout our community. So in Yakima County, 54.83% of individuals who are 16 and older have initiated vaccination, and 46.97% have been fully vaccinated. So we are still encouraging people to get vaccinated. We are seeing over 50% of our population who are 16 and older receive the vaccine. And just a reminder, if you received the Pfizer or the Moderna vaccine, it is important to get your second dose, as they require 2-dose series to achieve the highest protection. And as a state, we are close to that 70% of individuals who have initiated vaccination. So as a state, 63.66% of those 16 and older have initiated vaccination, and 55.66% have been fully vaccinated. So we are close, and we are very close to reaching that 70%. And if we do reach 70% before June 30th, we will be able to open up sooner as well. And this is great news that we're continuing to see people get vaccinated. And we want to see these numbers as well increase in our county too. So please continue to get vaccinated, share information with friends and family. And I'll be showing you towards the next half of this update more information on where you can find locations to get vaccinated. Okay, so now that we did share a few of these statistics, I also wanted to maybe go into talking more about what it means to be fully vaccinated. So fully vaccinated people can now do more activities even more safely, such as gatherings with other fully vaccinated people without wearing masks or social distancing, as well as traveling domestically without a pre or a post travel test. So maybe Dr. Yeka, you can go ahead and start us with how safe is it to travel? And then when traveling within the United States, what should fully vaccinated individuals continue to do? And thank you again, Dr. Yeka, for being here with us and providing us more information to the community for our update.
Okay, well, first of all, we're really glad to see people getting vaccinated, and that's really our way that we're going to get out of our pandemic and back to a normal life. So I encourage you there. And vaccination is a very effective tool, and that's why they are loosening up the masking standards and everything for those that are vaccinated. So it is safe to be around others that have been vaccinated and not wearing masks, and they have opened up travel more. However, when you travel, you have to, every state is completely different, and they have guidelines and the terminals will for transportation. So just be aware that, if you're asked to mask, have it available, and there will be some conditions where you might have to. But for those that are vaccinated, there are more and more opportunities. And I might mention that wearing a mask when you travel, especially in terminals, is not so bad. There's a lot of other diseases that pass through the upper respiratory system in places that have crowding people. So wearing a mask isn't just preventing you from COVID, but it's preventing you from other respiratory diseases also. So, but it is safer to travel now if you've been fully vaccinated. It's safer to be out in your community and be with others. So we encourage you to get vaccinated.
Thank you, Dr. Yeka. And yes, just to reiterate more of what Dr. Yeka said, if you are fully vaccinated, it's still important to wear your mask when you are in public transportation, which does include planes. So if you are traveling within the United States, you are required to wear masks in public transportation, such as planes, buses, or trains. And also, it is important if you are experiencing COVID-19 symptoms, regardless if you are vaccinated, to get tested and continue definitely following those CDC and Health Department recommendations for travel. Perfect. Let me go ahead and to check our Facebook to see if we have any questions at the moment from the individuals that are watching us. Okay, so it looks like we don't have any questions at the moment, so we can go ahead and continue, and hopefully more individuals will get to ask us a few more questions. There was a question, our last update that we had from a community member who was watching us. They did ask, are you familiar with comments made by Dr. I may be mispronouncing this doctor's name, Geert van den Bosch on vaccination? What are your thoughts? Is there anything you could possibly say about that, Dr. Yeka?
Well, this is one individual, is a veterinarian. I think he's from Belgium, and he gave a letter, and that was all. There's no, he is a scientist. He's not anti-vaccination per se, because he's working on vaccinations in his field right now. So experts, I don't know why he sent out an alarming letter saying that it might be harmful to humanity, because it doesn't make sense. There's nothing to back it up. The experts have looked at his reasoning, and we can say it's one letter and it doesn't meet scientific proof. So I think those are the things we shouldn't be looking at. We should be looking at the science from the experts, National Institutes of Health, CDC, reputable universities.
Perfect. Thank you, Dr. Yeka. And I will make sure this information gets to that individual that asked us this question a couple of weeks ago. Okay, perfect. Let's see. For those of you that are watching us, we do encourage you to ask questions. We do have Dr. Yeka who would be able to answer questions about vaccines that you may have or any information about COVID-19. But we will go ahead and continue on with our COVID-19 update for the moment. So earlier I was showing the statistics of the individuals who have been initiated vaccination as well as have been fully vaccinated, both in Washington State and in Yakima County. And then given Governor Inslee's announcement that we would open up sooner than June 30th if we reach 70% of Washingtonians over the age of 16 initiate vaccination, what is so important of the number 70%? Would you be able to talk to us a little bit more about what herd immunity means and why it's so important to be able to reach it as a state as well as a county?
Well, herd immunity is that which you have enough people either immune from the disease or immune from vaccination that it stops really moving along or moving, being infected from one to another, and it stops the infection. And so it kind of depends on the disease. Measles, you have to have over 90% almost to get herd immunity. But most diseases, it's around the 70%. And we think 70% would be probably good with COVID, because a lot of people have natural immunity. We've had a lot of people that have come down with COVID over the last year. So they have natural immunity. So if you add the natural immunity ones to the 70% that are protected with vaccinations, that gives you a pretty safe, uh, uh, I think, area where you think that, the COVID should be able to be controlled. So I think that's why they use the 70%. It's the best guess I think that the experts have at this stage.
Perfect. Thank you, Dr. Yeka. So we definitely want to encourage people to continue to get vaccinated. We want to reach 70% as a state of individuals who had initiated vaccination, as well as completed vaccination, and as well in our county too. So please take advantage of all those opportunities to get vaccinated that are happening every day in our community. And Dr. Yeka, it looks like we do have a question from a community member that is watching us. Darlene is asking, so if you got both vaccines, is there going to be a third one to follow? Do we know any information on that yet?
Okay, we don't know yet. We know that what it looks like, we're getting very good immunity. And we know it's probably going to be at least a year. We don't know beyond that. So it will just have to keep following because we haven't had anyone vaccinated for more than a year. So these will be coming up. They started the vaccination quite a while ago and experimental, before it was released. So we'll have that data to see what their antibody titers will be. So it's like with some, we just kind of have to wait and see, will it become a yearly thing like the flu? We don't know yet. There's just a lot of unknowns. I hope it's a lot longer than the flu, and it'll depend upon the variants and the mutations. If it starts mutating a lot and then you need a different vaccine, it might be a new vaccine for the next time you get your booster. It could be, those are things we don't know, and just stay tuned.
Perfect. Thank you, Dr. Yeka, and thank you, Darlene, for your question. So they are continuing to do more studies. So we will basically, technically stay tuned to see what more is going to follow in the future. So for the moment, there's no other questions. Let me go ahead and ask another one. How do we know that the COVID-19 vaccines will not cause any long-term side effects?
Well, the vaccine is a new vaccine. It's not a live vaccine. It doesn't enter the cell. It's a whole different technology. We really there would be no reason we'd have harmful effects from that. We haven't seen any, and we should have seen something now. Now we do know having the disease. There's many that have had the disease that have long-term effects. They almost get a fibromyalgia, they type symptoms. So we know with the disease, you can have long-term effects, but with the vaccinations, we don't expect any.
Thank you, Dr. Yeka, for clarifying that, because I know that is something that we've been hearing in the community too, who would like to know more information on those long-term side effects of the vaccine. And okay, perfect. And another question that we have heard from the community is, in terms of vaccines, what's the difference between FDA approval and an emergency use authorization?
Well, emergency use authorization can only be issued in a public health emergency. And as you know, we've been in a public health emergency now for over a year. And it doesn't mean that these vaccines haven't been tried and have gone through many trials. They've been in 3 different phase trials. They have an initial phase that just a few healthy people get vaccinated. If it works, then it goes in phase 2, then it goes phase 3. And there's a lot of science behind it, even with the emergency proclamation. The emergency is just to get it out quicker, because the FDA usually goes through a more lengthy process that takes up to a year or 2. Now all the vaccine makers are applying for the regular FDA approval. And I think it'll be issued shortly here, because we've had, we've given over 300 million doses in the United States, and it's been very effective and very little effects. So I think it will be on the road to FDA approval. But without a public health emergency, the emergency status isn't. It's just a quicker way to get things in the marketplace in an emergency.
Thank you,
I hope
Dr.
I haven't
Yaka.
muddied the waters.
Thank you, Dr. Yaka. And then another question that just came to my mind too is I know the vaccine, anyone over 12 years old is eligible to receive the vaccine. So the Pfizer was approved for 12 to 17-year-olds. Are they also doing any other studies on different age groups for the
Oh, yes.
vaccines?
Yes, they are. In fact, as we speak, the others will be have already gone in for earlier, and the trials are in younger children now going on. I think it might be by probably late fall before we're going to see the younger groups, younger than age 12, but they definitely will be probably within by the end of the year.
Okay, thank you, Dr. Yeka. That's a lot of good information, valuable information. So we'll still be hearing to see what more news come up about the vaccines and if more people will become eligible, as well as if we will be needing a third dose as well. Okay, so it looks like we don't have any questions from the audience yet, but I'm going to go ahead and transition over to show individuals the mobile vaccine units for the week that are happening, and then maybe we'll get a few more questions from the audience for those that are watching us. So I'm going to go ahead and share my screen again, just to provide a little bit more information and then see if we have more questions too. Okay, so hopefully individuals can see my screen. So we're still continuing to administer vaccines at the Community Vaccination Center that's located at the State Fair Park. And then I did want to just say as a reminder, on Thursday, June 10th, and on Sunday, June 13th, so this Thursday and Sunday that are coming up, the Community Vaccination Center will actually be relocated to Astria Regional Medical Center's parking lot on 9th Avenue. And we will go ahead and put more information on our vaccine page here at the very top to provide individuals that information, but it will be relocated on June 10th and 13th to Astria Regional Medical Center's parking lot. And for this week, there's a lot of opportunities to get vaccinated. Every week, I will be updating this yakimavaccines.org page to provide individuals more information on the mobile units that are occurring throughout the week. So it looks like today we did have four mobile units, and they are all in a variety of locations, so they may be close to you. So today we have one in Grandview, Sunnyside, Yakima, and Nafton. So lots of different opportunities for individuals to continue to get vaccinated. And tomorrow it looks like we have about 3 more. And again, both 2 in Yakima, 1 in Grandview. And then the list goes on by date. There's lots of opportunities to get vaccinated. And if individuals are at the Toppenish Flea Market, the Yakima Downtown Farmers Market, the Yakima Farmers Market in Union Gap, those mobile teams are there every week. So please continue to take advantage of those on Sundays. And there will be lots of opportunities. So here's a lot more information. And again, this page is yakimavaccines.org. So we encourage individuals to share this information with their friends and their families. And if you know anyone that speaks Spanish, we do have a Spanish page as well for individuals to share more information on too. Okay. And again, just a reminder for those of you that are watching us or had just joined us on June 10th and June 13th. So Thursday, June 10th and Sunday, June 13th, the Community Vaccination Center will be relocating to Astria Regional Medical Center on 9th Avenue. And we will be posting more information at the very top here to provide and redirect individuals to that location for those 2 days. Perfect. So I'm going to go ahead to see if we have any other questions from our audience. Okay, so it looks like we don't have any questions at the moment. Oh, give me 1 second. Oh, we do have a question, Dr. Yeka. Maybe you will be able to answer this one. It says one of them says, my barber today said he was following CDC guidelines, but nobody was wearing a mask and none were vaccinated and no one was socially distanced. What are guidelines for hair salons and barber shops?
I don't have the latest, but I know I was just to my barber, and L&I, they still recommend masking. And it's up to, and I haven't seen anything less than that. So they should be following L&I guidance, and I haven't seen anything different from L&I.
Thank you, Dr. Yeka. Casey, hopefully that answers that question. And then Misty does have another question. Misty states, will Moderna be restocked in Yakima?
What was the question? Will Moderna be what?
Be restocked in Yakima? I do know, I can
Yes,
look at it.
I'm sure we'll have some Moderna. I mean, you're worried about the second shot. Yeah, we just have to check with the schedules, and there will be, I'm sure there'll be some Moderna too. There always has been. I wouldn't know why they wouldn't, but you just have to check and make sure they have it at the site you're going to.
Yeah, definitely. So if you did receive your first dose Moderna, you can definitely try to check back to see that location that you did receive your first dose to get your second dose. I know at the Community Vaccination Center, we are offering Pfizer vaccines, and on our yakimavaccines.org page, we do have more information of other clinics too and other providers that are offering COVID-19 vaccination. So if you are needing your second dose of the Moderna, you can definitely call those locations to schedule an appointment as well. Okay, perfect. So looks like for the moment, there's no other questions. Before we do end it, and if individuals have any other questions, Dr. Yeka, is there other additional comments you'd like to share with us before we end this update? Other information to give individuals who are watching us?
No, I think we're seeing the right numbers. We're seeing cases still decreasing in Yakima, although they still are above 100 per 100,000 for a 2-week period, which is still in the high range, but they are going the right direction. I think the only way we're going to really control it completely is through vaccinations. So encourage everyone to go out there and do your share. Do it just for yourself, do it for others, do it for your loved ones. It's just not protecting you, it's protecting others.
Thank you, Dr. Yeka. And now with summer approaching too, we want to gather with friends and family. So definitely get vaccinated so you can gather safely and enjoy the summer. Definitely take advantage of all these opportunities. And again, please give all this information to your friends, families, neighbors. They may want to get vaccinated and may not even know the information or where to get the vaccine. So if you could please provide them the information on our yakimavaccines.org page, maybe give them a ride, or just provide them any other information from the CDC, or even share why you chose to get vaccinated. That'll hopefully help their decision to get vaccinated too. Perfect. And let me just check if we have any last minute questions before we wrap up on tonight's update. We do have one more question, Dr. Yeka, but if you're not able to answer it, then I can reply to this individual at a later time. But Casey does have a follow-up question. They ask, what are the rules on whether employers can ask if employees are vaccinated, and can employers require employees to get vaccinated?
I think you're going to have to look at the more specific. Yes, you can ask. And I do know that. And are they required to be vaccinated? They're going to be required to wear masks. They're going to be required to do other things. I don't know. I don't think there is a mandate yet on the vaccination. In fact, because it is under emergency authorization, we went to that FDA approval versus emergency approval. You cannot actually mandate. However, if it becomes FDA approved, then there's a difference in the legal interpretation of mandates. So for right now, I'm pretty sure there is no mandate, because of the emergency rule. However, there'll be stipulations of work environment that it can be mandated. You can't be mandated to wear a mask, social distancing and other things.
Okay, thank you, Dr. Yeka. And one of the individuals, Misty, who asked a question states, these lives are so informative. You do a great job. And then Casey with that other question stated, huge thank you. All righty. Okay, so that'll wrap up our update for tonight then. Thank you everyone who joined us for tonight's update. Our next update will be on June 22nd in 2 weeks. Same time and same place here on our Facebook Live. And for those of you who are watching us and speak Spanish, gracias por acompañarnos hoy. En esta actualización vamos a tener nuestra actualización en español la próxima semana, que sería el 15 de junio. A las 6 van a tener mucha gran información con la doctora Consuelo. And again, thank you, Dr. Yeka, for all your time and for providing us all this valuable information to our community.
Thank you. Enjoyed being here.
Thank you.